I'm Russ McLean, Chair of the Patient Voices Group for Pennine, Lancashire, and today I'm in conversation with the Chief Executive of East Lancashire Hospitals Trust, Mr Kevin McGee. Hello, Kevin.
Good afternoon, Russ.
Now, I'd like to start with a question around STPs, or the Sustainable Transformation Plans, and many patients are concerned that this will mean a reduction in services, specifically the number of patient beds available. And of course, you and I have talked about this at length before, but this particular question follows research by the King's Fund, which shows that there have been a significant reduction in the number of beds available to patients. Apparently, over the last 30 years, bed numbers have halved. The question then, Kevin, will you lose beds at ELHT?
So I'm sure that over the last 10, 15, 20 years there has been reductions in beds in the NHS generally. I can say with certainty at this point that we're not looking to lose any beds from the work that we're doing through the STP process. What I can't say is that we'll never change. So if you look at the health and you look at the hospital now and the configuration of beds and services, it looks very different now to what it did even 5 years ago. So health provision is continually changing. We always need to make sure we provide the right number of beds and the right services in the right locations. So there will be changes going forward, but I can absolutely say there are no plans to reduce our overall bed numbers.
I had a question from a patient about East Lancashire Hospital Trust and how it gets paid for providing health services. Patients see the NHS as a seamless organisation, but in fact there are lots of different healthcare providers, of course, all commissioned to provide health services by central government, locally by clinical commissioning groups, of course. How does that work, Kevin? What actually is the process?
So if you go back a number of years, we were all encouraged as providers to try and get to foundation trust status. And the way we were paid is for every patient that we saw, we got paid a tariff. So if somebody came in for a hip operation, for instance, they would get paid a standard national figure. If you came in for an outpatient appointment, you would get paid a figure for an outpatient appointment. So you could see how that with the foundation trust, with the payments by results, it actually fostered quite a lot of competition, and that was sort of the norm, and that was what we were encouraged to do, to really improve services through competition, compete for activity and be successful that way. I think more and more what we're seeing is that because of the restrictions on the funds that are available, because of actually is that the right way to look at healthcare for the future, and should we be more in collaboration between organisations? Should we try and integrate services more, and should we stop competing? And I think there's a movement away from payments by results. There's more of a movement towards get paid annual sums for level of activity that you undertake. And there's something that's starting to emerge in terms of funding that we're calling capitation funding. So, and that's based on looking at the population that you serve, based on the number that you serve, but also looking at the socio and economic issues that you face in areas, looking at the demography, looking at rurality or urbanisation, looking at the health of the population. You get paid so much per head per population, and you provide the sum that way. And I think that's the way we're going to go eventually. But at this point, we do still get paid through a tariff based on the patients and the number of patients that we see.
Well, I guess that answer has almost alluded to the next question, which was about the same levels of treatment. So would you get paid annually the same amount of money providing the same amount of service as a hospital in, say, the South East?
Generally, yes, but what happens is that we don't get paid the money directly. The money comes through to our clinical commissioning groups, and they commission services from us. Now, the clinical commissioning groups will get paid depending upon the makeup of their population. So, for instance, you'll get more if you have a very rural population, or if you have a population with very deprived needs. You could potentially get more. If you're in London, you get what they call a London waiting for providing healthcare. So that money would then come through to commissioners, and then we would get paid from the commissioners based on the activity that we undertake.
We touched upon foundation trust status a moment ago, and the trust was said to have been going for foundation trust status. Has that ambition declined?
Well, you are right, Russ. I mean, if you look at our objectives state that is to become a successful foundation trust. I think over the next year or so, we will need to change that, because I don't think any organisation has reached foundation status in the last 2 or 3 years. And I think what we're seeing more and more, it's a recognition that the foundation model is something that's not applicable going forward. So what we're trying to do, as I said, is to get organisations to work in conjunction with one another, not to be in competition with one another, and actually to integrate services as opposed to have standalone foundation trusts. So I don't think that we will become a foundation trust. And I know it's using jargon, but what I think we will end up seeing in East Lancashire is us moving towards what we call an accountable care system and an organisation where we break down the barriers between commissioners and provision, where we break down the barriers between different providers, and everything's provided under one banner, one organisation, so that we don't have duplication of services, we don't have more overheads, we don't have different management cost layers, and I think that's absolutely the right way to go going forward.
Have you seen a reduction over the last 12 months in the number of joint operations that you've been commissioned to provide?
No, not at all. In fact, if it's, I think we employ something like 24 orthopaedic consultants, and we do joints, upper limb joints, lower limb joints. No, absolutely, we've not seen a reduction in the number of joints that we're being commissioned for.
Kevin, I've had a number of patients contacting me over the last few months, very, very concerned and upset about the length of time that they're having to wait for the results of 24-hour ECG monitoring. So these are patients who have come in, they've had a pre-op assessment, they've had 24-hour monitoring, and then they're waiting for results, so they can't have the procedures. The whole thing's held up. Is there a problem with results? Have you a problem in cardiology?
So that concerns me. I'm not aware that we have any particular issues around cardiology and waiting times. So I'll certainly take those questions forward, Russ, and investigate that and come back, because I am not aware that there should be any delays really in terms of reporting cardiology results.
One of them particularly alarmed me. This particular lady had waited 2 months, which I think is perhaps a little unacceptable.
It is unacceptable. I mean, like I say, I can't comment on the general case because I don't know any of the details. However, it worries me that if there's a perception that we've got long waits for cardiology, I will investigate that and find out the reasons.
Thanks for that. The NHS is not fit for the 21st century, and so says this new hospital inspector, Ted Baker. He's saying that hospitals are set up as they were in the 1960s, that they haven't moved on, and that people or patients waiting in corridors on beds is the new norm. Will that ever be the new norm at DLHT?
No, certainly not. Absolutely not. I mean, it's never acceptable for patients to be cared for on corridors. Very occasionally, in the height of winter, we only have enough physical capacity in A&E, and sometimes you may have patients who are waiting to go into the cubicles. But in all cases, patients will be looked after and cared for appropriately. It'll be close to the A&E department. There'll be enough staff, and not only the patients, but their families and relatives will also be catered for and looked after. It's not acceptable that patients are cared for on corridors, and it shouldn't happen. There have been occasions, particularly in the height of winter, when we've had patients that come through ED, when we've had longer than we would hope for and wish for waiting times, and that's not acceptable. What we do on those occasions is make sure that those patients and their families are looked after appropriately and cared for. It's fair to say that the NHS is under significant pressure. It's fair to say that the NHS, I think, does need to modernise its services. But we are incredibly lucky in this country. We've got some of the best healthcare in the world. It's healthcare that's free at the point of access, and I think we should be very, very proud of our NHS. But that's not to say that it shouldn't change. And health services will continually need to change to meet the needs of our population, because the needs of our population continue to change.
The question of patients on hospital beds in corridors leads me to the next question, and you and I talk about it at every one of these sessions. But how are you doing with your current A&E 4-hour target?
So we're actually improving, and in comparison to how we do on a national basis, it's really good. So during the early part of the summer, we did struggle. And we were set a target for this September. We needed to be back at 90%, and we've hit 90% in September. So that's really important for us. We need to continue and improve so that we get it back up to the 95%. But if you look at it on a national basis, we'll compare fairly favourably now with performance on a national basis, and certainly within Lancashire and Cumbria, we're one of the better performers. But A&E is continually under pressure. There's issues around the physical capacity. There's issues around enough doctors and nurses to staff A&E. But I have to say that the staff that we have who work in our urgent care departments, our A&E departments, are absolutely magnificent. They're some of the best staff that you'll find anywhere, and I'm really proud of the job that they do.
How worried are you that you may be perceived as a trust to be underperforming? We hear in the press all sorts of things about chief executives getting dragged in and hauled over the coals for not achieving those targets. Is that something that might happen here?
Well, I mean, if we don't deliver, then, clearly there's an accountability. So I accept that as being a chief exec of such an important organisation, and it comes with the job. But, we do perform well against the vast majority of quality and performance metrics. I'm really proud of the work that we do. Your listeners will know we've just got a good rating from CQC. So generally, this is a good, well-performing hospital. But we have to continue that. And as with every acute hospital in the country, we are under pressure, and we will be under pressure during the winter. There's never, we could always spend more money, and we always have issues about being able to employ the right number of doctors and nurses. But these are the challenges that every hospital in the country face.
Well, let's touch upon that. Money, it's all about money and resources, and that money just isn't there for the NHS at the moment. The government are talking about releasing extra funds for A&E and winter pressures. But let's put the boot on the other foot. What should the public, what should patients be doing to help the hospital achieve those targets? Because there are ways in which surely patients can help.
I think we all need to support and help one another. So, it's not all about money. Even if I was giving more money, there's actually, on many occasions, there's not the doctors and the nurses to employ in certain areas because, there just isn't the right number of trained staff. But I think, again, it's a thing that we've always talked about in terms of looking forward to winter now. Only turn up in our ED and urgent care departments if there's nowhere else to go. You can go to your GPs, you can look at your pharmacists, you can go through to 111. So there are other ways and other support that you can get rather than just turning up at the ED or urgent care department. And of course, we all need to look after ourselves going into winter. So it's just the normal stuff. If you can get the flu jab, I would encourage everybody this winter to take the flu jab and to have the flu jab. And look out for one another, be good neighbours. If you've got elderly relatives or elderly neighbours, just look out for one another. The more we can support one another, the less pressure that will bring on the hospitals and allow us just to focus on the people who absolutely need our services.
Every day there's another report, and on Friday the Royal College of Nursing, or the RCN, released a report stating that nursing staff shortages were compromising patient care. Let's look at ELHT. Do staff shortages affect patient care here?
So we monitor very, very carefully on a daily basis the number of staff that we have on every ward and every department. And every shift that we have staffing ratios that we try and deliver. The majority of those times that we deliver those staffing ratios, and they are based on professional judgments about the nurses and the doctors and other staff required to keep the wards safe. Occasionally, when we have short-term sickness or other issues, we may have some gaps on our wards and departments, but what we try and do is cover that from other areas. So generally, all our wards are safely staffed and will continue to be safely staffed.
Leading on from that, there have been reports in the press just this week about patients being left to die on their own. Presumably what the papers are alluding to is the fact that because of staff shortages, there aren't the staff to be with these terminally ill patients. Is that something that you've heard about across the Trust?
Well, that's certainly something I do not recognise within East Lancs Hospitals Trust. I mean, we have a very good and very supportive end-of-life service, and I think all of our staff are very caring, very compassionate, and really look after not just the patients but the families themselves. Our staff are clearly under pressure at times, but absolutely I do not recognise that. And in fact, our end-of-life services have won national awards for how good they are and how caring and compassionate the staff are. So, I mean, clearly, end-of-life care is vitally important to the individuals concerned and their family, and it's really important that people at the end of life are treated with real respect and dignity and are given the most support that we possibly can. I would hope on all occasions that we do that, and it's something that we take very, very seriously.
At any one time, a sixth of the population in England, aged 16 to 64, have a mental health problem. This is according to statistics body NHS Digital. Now, although you aren't commissioned for providing mental health services in East Lancashire, you will be getting patients, obviously, who present with mental illness. Does this cause a huge problem? Is it a concern for the Trust?
So we're seeing more and more people presenting both with physical health and mental health issues, and that's particularly acute through our A&E department. So at any one time you will normally find patients in the ED department who have got both physical symptoms and mental health symptoms. And clearly we work very, very closely with our mental health providers, Lancashire Care Foundation Trust, to try and support those patients. It's fair to say that on occasions there has been, particularly when patients need to be admitted for mental health beds, on a national basis there has been a shortage of some mental health beds. But again, we do work really, really closely with our mental health colleagues, and we try and provide a service that is holistic, so that looks after both their physical health and mental health. So we bring staff from Lancashire Care Trust with our own staff together to support such patients. But you are right, more and more we are seeing patients presenting with both physical and mental health issues.
On the East Lancs Hospital Trust website, there's a link which allows the public to contact you directly. Do patients contact you through that medium, and do you actually read what's written there?
So absolutely, patients do contact me, and I do read and respond to everything that comes through. And they tend to generally fall into two categories. Firstly, we do get complaints through that route, and then we deal with that through the normal complaints route, and I read, investigate every complaint and sign every complaint letter. But we also get a number of compliments as well. The number of people who have a really good service within East Lancashire Hospitals Trust is magnificent, and I get some wonderful compliments from patients and their families for the care that we've had, and we always pass on those messages to staff, because it's really nice for staff. They're engaged in some really difficult jobs. They're under immense pressure every shift that they undertake, so it's great that they can get some really positive feedback.
The Trust has recently advertised for volunteers to become involved with the hospital. Kevin, how important is it for the Trust to have these people, members of the local community, involved in what the hospital's trying to achieve?
It's absolutely vital, because if you think about all the services, they're not my services, they're the services of the local community. It's really important that those services are embedded in the local communities, and one way of doing that is for people to volunteer and to support. So at any one time we will have 400 volunteers supporting the work that we do. They provide the most wonderful support. So we've talked about end of life care. They can support some of the stuff that we do around end of life care. They work on coffee stalls. They can work in terms of just showing people around hospitals and getting people to the right locations. They work on front desk. Our volunteers are absolutely essential to us, and they do the most wonderful jobs. We really do welcome everybody volunteering, and I am really supportive of the work they do. They're fabulous.
So if someone listening to this would like to offer their services as a volunteer, what should they do? What's the first point of contact?
So if you go onto our website, there's a route that they can go through our website. But you know what? The easiest way is just to drop me a line, and I'll put them in touch with the relevant people.
Thanks for that. A specialist ward at Burnley General Teaching Hospital has become the first to receive a new award recognising the outstanding care provided by its nurses, healthcare assistants, doctors and support staff. The Gynaecology and Breast Ward is the first to be presented with a Safe Personal and Effective Care Silver Award. Tell me a little bit more about that. How did that come about?
We've been looking for a way to really get our services not just from good, but to get them outstanding. So what we've done is introduce an accreditation process for our wards and departments, whereby they have to reach the highest standards of patient care, patient experience, clinical care, friendliness, cleanliness. They have to have a wonderful environment as well as the clinical care that they provide. So there's a very detailed criteria that the wards and department need to hit. They have to be audited on 3 separate occasions, and on 3 separate occasions they have to have reached the green standard. After that 3rd occasion, if they hit the green award, they can then put a submission through to the trust board, and the trust board, if it feels it's appropriate after they've reviewed and been for a visit, can award them our silver SPEC award, Safe, Personal and Effective Care. But it's really a benchmark, a kite mark of outstanding and excellent service.
And talking of outstanding things, I've also heard about this UNICEF Baby Friendly Gold Standard. So more good news for the Trust.
Oh, it is. And again, this is very much, if you like, a kite award for the best performing services, maternity services in the country. And we've been awarded this through UNICEF. We're one of very, very few departments anywhere to get this, and it recognises the very, very highest standards that are provided in maternity services within East Lancs Trust across both our birthing units and on the Burnley site through the Women's and Newborn Centre.
Well, that's about it. Kevin McGee, Chief Executive of East Lancashire Hospitals Trust, thank you very much for your time.
And thank you, Russ, and thanks for the questions and your listeners' questions. There's some difficult ones, but really important questions in the questions this afternoon. Thank you.
You can contact Kevin McGee and ask a question for this audio blog by contacting the address at the number at the end of this presentation. But please do remember that we cannot discuss individual complaints through this forum. I'm Russ McLean. Thank you for listening.